The following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Welcome to the Empower Hour with Greater Nashua Mental Health. The Empower Hour will provide information and support about mental health, substance use, and behavioral health. Our goal is to share inspiring stories about transforming lives, to strike down stigma, and to encourage our community to reach out and get help when needed. Mental health is part of all of our lives. It's time we talk about it. I'm Dr. Cynthia Whitaker, President and CEO of Greater Nashua Mental Health, and it's time to get empowered. Welcome to the Empower Hour with Greater Nashua Mental Health. I'm Cynthia Whitaker, the President and CEO of Greater Nashua Mental Health. And today with me, I have Sheila Considine Sweeney, who is our Director of Integrated Care. So we'll be talking about the importance of whole person healthcare, mental health, physical health, substance use disorders, spiritual health, all that means today. And so I'm very pleased and honored to introduce you to Sheila, who's with me today. Welcome.
Thank you. I'm very excited about being here today and you giving me the opportunity to talk about something that I love to talk about.
Well, then let's start with you talking about what you love to talk about. So why don't you introduce yourself to those that are watching? So who you are, what your role is at Greater Nashua Mental Health, and kind of what excites you about that.
Sure. Well, my name is Sheila Considine Sweeney. I know it's a bit of a mouthful, and I am the Director of Integrated Care. I have been with Greater Nashua for, already over 2 years. And what do I love about integrated care? I love that finally we're joined together to treat the whole person and no longer, or moving away from siloed care. As someone who's worked in the field for a really long time, I was always frustrated that my clients would have to see so many different providers in so many different locations. And as one of their providers, I would spend so much time trying to get someone to talk to me about how I could best meet the needs of my client. And all I wanted was someone to invite me to the table so that we could work together in the moment. So when the opportunity arose to come to Greater Nashua, I was like, I have to get this job. I'm going to do what I need to do because this is where I belong. Finally doing what I believe needs to happen. So thank you for that. And here I am.
Welcome. So excited that you joined our team. It's funny, you just took that answer in a little bit of a different twist because I think sometimes when people talk about integrated care, they focus very much on the person or the client getting the care. But you really also just mentioned the team.
Yes.
And so that the team being siloed impacts the care that the client gets. So what does it look like, or what's the impact of having a team that's more collaborated?
I think it can be life-changing for the client. And it allows us as professionals to do what we do best and meet the needs of the client and help the client achieve their goals. And so when I talk about a team, I talk about a multidisciplinary approach to care, allowing doctors and case managers and nurses and functional support specialists to join together to, and I should say the other medical providers to meet the needs of the client. So much work can be done in support of the client in a limited amount of time. It's effective, it's efficient, and it's respectful of the client.
So I'm envisioning what we call huddles, right?
Yes.
So, it's a day, people come together, people are seen by their physical health practitioner, but at the end of the day, there's a huddle and all their mental health practitioners are right there along, and maybe a substance use disorder practitioner as well, right? I mean,
yes, actually, huddle's happening about an hour from now, where we have our psychiatrist, we have our physical health provider, we have our nurse, our medical assistant, myself, another project manager, case manager, getting together and talking about each client that's seen at our integrated health clinic during the session today, where they're at, what's going on, what needs follow-up, what are the concerns other team members have. So the client, is leaving their appointment today with a plan in place and with the members of their team being informed so that we can help that client continue to move to achieving their goals.
I know a lot of people are always hesitant about that because they think, oh, it's people sharing all this information, or if I share something with one provider, I don't necessarily want another provider to hear that information. But I'm hearing you say, but it brings better care when that happens.
Yes.
So what would you say to somebody if they were worried about providers sharing information back and forth?
I would provide some education on confidentiality and HIPAA, and that it's our duty to protect that privacy, and the benefits for us working together, that it increases access to care, it reduces barriers, and also allows them to receive the most efficient care with hopefully reduced wait time and quicker follow-through. Most of the time, clients just need education. They need to understand, and they need someone to take the time to explain it and not just push a paper and read this. I believe in the one-on-one, the human approach. And I think that's what integrated care is well. It's the treatment of a person, not their condition.
Right, exactly. Getting to understand what the person really needs in every aspect of their life, then lets us treat them the best we can.
And what they want.
Absolutely.
And I think sometimes, because many of our clients have been seeking services for such a period of time that sometimes what they want has been missed. And if we take a step back and think and ask, what do you want? Because what I think they need and what they want may be different, and we can work on that path together.
Right. Sometimes if we come together and really understand what's going on, we might come up with a better option that neither one of us had thought of before.
And that's the benefit and the beauty of the team.
Yeah.
Everyone brings in a different perspective. I have a lot of respect for that, and I think our clients have respect for that because they see many people caring about them but coming from different perspectives.
So we're a mental health center, and we've got this physical health provider inside our mental health center providing physical health services. Our physical health and mental health providers are coming together to improve kind of the all-around care for the clients that are enrolled in these programs. Have you seen any major outcomes, or are there any stories that sort of stick out for you of any clients that have been able to make a change?
Yes, and I often ask people, don't you want me to tell you a story? Don't you want me to tell you about the real life people and not just the data that sometimes I have to produce to support the work that we do, which is very, very important.
Yeah.
But I like to talk about, the human stories. And one gentleman that I think of who I believe has been involved at Greater Nashua for a significant period of his adult life, who's a member predominantly of another treatment team that comes to us for physical health care, but is also involved in pro health, which I'm sure we'll get to, in our wellness programs. And he's been a chronic smoker and has had, chronic health issues just related to not receiving primary care, has really cycled through the emergency rooms and urgent care, has, finally settled with us and has engaged in our wellness programs. And for the first time in his life, he's a couple of months smoke-free at this point. He is becoming more physically fit. There's been a reduction in, inpatient behavioral health hospitalizations. He's engaged and positive and informed and an active member of his healthcare. I often bring him up because I remember when I first started at Greater Nashua a few years ago, he was resistant to coming into the program.
Yeah.
He was always someone that was smoking in the parking lot, and I would have to say, we're a non-smoking campus, and he'd be like, yeah. Now, when I walk through the parking lot in the morning to get to my office, I usually see him, and he'll tell me how many days he's been smoke-free.
Oh, that's so cool.
Or he'll say to me, I just had someone go, to the sidewalk to smoke, and he's proud of that. So that's a wonderful story. That gives me
That is
hope.
a wonderful story. So you mentioned the wellness activity. So it's not just that we have a doctor that comes in, or a nurse practitioner or a PA, or somebody that comes in and provides medical care, but we also have other wraparound wellness services. So what does that look like?
Yes, we have wraparound wellness services. Because we treat the whole person, we realize we're more than someone's blood pressure. And so when we say we have wraparound wellness services, I have health mentors that can help someone along with their personal health goals, whether that's becoming more physically fit or just improving nutrition. I have an integrated care counselor, wellness clinician who meets with clients about smoking initiatives, to decrease smoking, to address vaping, to look at nutrition and, again, increasing activity, and really helps with targeted health interventions. And we ask them, what do you want to see be different in your life? Because my health, initiatives and wellness challenges are different than yours. So, someone may say, well, I'm not sure I want to give up smoking, but I want to be educated. I want to know what's happening to my body. We can do that, and we can use our skills to hopefully get them to a place where they contemplate change. I wish my primary care office offered those type of things. We also have the capacity to offer, smoking cessation counseling, and also in a group model for people who want that support. So, I think we can be inventive and innovative, and really, meet someone where they're at, and the ability to change and flex when the needs change and flex. So I'm really proud of the different things that we offer. Our health mentor program, it's basically having a personal trainer and advocate by your side to help you, even when you don't want to exercise. Some days, they go and they see a client, and that client doesn't want to exercise. Okay, so let's talk about why you don't. And let's talk about what we can do next time, or, let's go to the grocery store instead and, take a look at things. Or let's look in our cabinet and see what we can look for dinner. There's so many different things that we can do. We really try to meet clients in the space that they're at and support them. Tomorrow is a new day. We can do something different.
So the interventions are both individual and perhaps in groups,
Yes.
depending upon what groups are being offered.
Mm-hmm.
So I heard nutrition, I heard exercise, I heard talking about barriers that get in the way.
Yeah, we've offered, because of Zoom and due to the pandemic, we've had to be creative. So we've offered cooking group where clients can log on, and one of our health mentors share a recipe that and we demonstrate how to make it for them. So we've had to do a lot of different things to meet people, due to the restrictions of the pandemic. We publish newsletters that provide not only our clients but our staff support and healthy activities or healthy recipes. Had to be really creative this past year, but technology has allowed us to make that happen. And we also respond to what the clients want. I had a client say to me, as I was walking to my office, they like to stop me in the parking lot because they call me the integrated care lady. That's my nickname, I heard. And so they'll say to me, why can't I walk with my health mentor, by Zoom? I said, well, what do you want that to look like? Well, on my cell phone. I said, well, we can do that. So I have one of my health mentors he's not seeing his client physically yet, or wasn't in the height of the pandemic, but they would talk on the phone while he and his client would, walk together virtually and engage in those activities. That's pretty darn cool.
It is pretty darn cool. Yeah, to be innovative like that, meet clients where they're at, give them what they need. It's really awesome. You mentioned Pro Health, so that's kind of our internal jargon for a special program within the integrated care program.
Yes.
So what is that?
ProHealth is a SAMHSA grant that we were lucky enough to receive. It's a 5-year grant that targets health and wellness initiatives for clients that have severe mental illness or severe persistent mental illness. And in particular, it targets smoking cessation and general health and wellness indicators like BMI, blood pressure, cholesterol. So it's targeted to the transitional age of 16 to 39. I think they've stretched the definition a bit, but I'm happy about that. And really targeting people that should be at their prime health, so that they'll stay in their prime health. Because often I remember being, 18, 20 years old and, why do I have to worry about my health? I'm young. And that's a true statement, but we know that preventative medicine is important. And, many of our clients haven't made some good decisions along the way or haven't been able to address their healthcare needs. So we were hoping that this program that is launched within our integrated healthcare clinic could encourage clients to engage in preventative healthcare and target general health and wellness through incentivizing engagement and positive decision making. So we monetarily compensate them to participate. And again, I think that's pretty darn cool.
Yeah.
Because who isn't motivated in some way by money? And another cool thing about this study is that it utilizes things that are near and dear to that age group, like their cell phones and apps on their cell phone, so that they can they don't have to come and see me necessarily. They can engage in a virtual platform, and allows them to be compensated to do that. So, they come and see us for an interview or meet with one of our clinicians. Often they're incentivized anywhere between $10 and $30 for engaging in these programs, such as completing a smoking survey on an application a couple of times a week, or logging into a food journal a few times a week, meeting with the wellness clinician, and engaging in a Weight Watchers program. So they're incentivized to hopefully make behavioral changes that will last post their enrollment in the study. And they can stay in the study for up to 5 years. We are in year 3 of the study, so we still have some time to go. We have probably over 30 clients that are actively enrolled in our Healthy Choices, Healthy Changes, which focuses on general health and wellness, and around 10 clients that are currently engaged in the Breathe Well, Live Well program, which targets smoking cessation and vaping cessation. And I think one of the data points that have come out from the study so far is that the majority of our clients really aren't smokers, they're vapors at this point. And we've been able to be innovative with the study and really change curriculum to target vaping. Greater Nashua was the site chosen to actually pilot the vaping curriculum and engage clients in that, and seeing some positive results, like the gentleman I shared earlier about.
Yeah, sounds like another way of being innovative. We learned something and then we were able to make a shift.
Yes.
And provide clients what they needed, rather than saying, oh, we've got this curriculum and now it might not fit you, but here it is. Like, no, we figure out people need something different. So shift in that area. And what I love about the ProHealth program is it's like giving this external motivation to get engaged. And the hope is that, clients then see change, which then helps them build their internal motivation to stay involved and keep going.
I agree. And clients that are in the ProHealth program are often involved in other programs at Greater Nashua. And we're able to work collaboratively with the other programs to continue to support that behavior change, in particular with our clients that are enrolled in our substance use disorder services. Nicotine dependence affects many. So, we've been able to really provide support to the SUD department and provide more nicotine education, and are in the process of piloting soon, hopefully in the next month or so, a 4-week group over in the SUD department for clients that want to learn more about nicotine education and nicotine cessation.
So bringing some of the more health and wellness into other parts of the program, because often when people went to traditional or historically, typically substance use disorder or SUD treatment programs would focus on the alcohol or the opioid use and would not bother with also trying to change nicotine or cigarette smoking or addiction. And I love that this integrated way of coming together is, you might not be ready to change, but we should at least be providing that education or, again, it's not just one or the other, but as much as you're ready to engage in, we're ready to provide.
I agree, because back in the day, I remember telling clients, nicotine is the least of your problems right now. Let's focus on this bigger problem. And, that was back in the 80s and 90s. And, things have evolved.
Yeah.
So I'm glad that I can be able to promote and provide these other services that will help someone's overall health.
Right. Because even if I help you with one addiction, but you're still using substances that are causing you health problems, the cycle continues.
Yes.
It reminds me that we might want to talk a little bit just about the substance use disorder services in general too. So as the integrated care director or the integrated care lady, I might start using that, Sheila. You're over not only these health and wellness programs, but you also provide support to our substance use disorder programs to make sure they're not these siloed programs kind of off to the side, but they're really kind of coming into the department. So, what excites you about that, or what would you like to share about what we do that's kind of exciting or different? Or
Well, I was very honored when I was asked to oversee the SUD programming over the summer. It was one of the things when I started at Greater Nashua, I would read the brochure for integrated health, and it talked about what is integrated care, and it would say the physical health, behavioral health, and substance use treatment. And I would always think to myself, well, one of these days I'm going to have more than a consult on my team. And, I went along my merry way, continuing to do my work, and then the opportunity came, and it felt like home. It felt like that's where it needed to come under the integrated care umbrella. My background, for a lot of years I worked as a treatment center director. And I know I've already kind of expressed my frustration as that director before, because many of my clients I felt were stigmatized and weren't receiving the quality care that I felt they deserved. And Greater Nashua provides all of this care in under one roof. So I jumped at the chance to be able to do that. And it feels like home. I'm going to use that word again. We provide many services in the SUD department. We have a wonderful coordinator of SUD services as well as a drug court coordinator. So we have 2 separate programs that are going on. Our community-based SUD department provides individual care, group care, and IOP, intensive outpatient level of care, as well as family support. And then we also have our drug court program where Greater Nashua works collaboratively with Hillsborough County South, I hope I'm saying that correctly, to work with clients that have a deferred sentencing program. So they're 2 phenomenal and very separate programs that work under the integrated care umbrella. So we're not only meeting them with the services they need in the SUD departments, but also making sure that we're, as soon as they walk in the door, asking them, do you have a primary care doctor? When's the last time you saw a primary care doctor? Because it's important. Your health care is important. And getting them actively engaged in those services. And then we can start the conversation of, we have this wellness programming available. What other supports can we provide you? I think it's been a really nice flow. Clients are really feeling from the moment that they come into Greater Nashua that their needs are being assessed. and appropriate referrals are being made. We have like a 72-hour turnaround for getting someone's paperwork completed to come into our integrated health department to receive primary care services, because we don't want people to wait, because I think we know when there's a delay in care, sometimes the care doesn't happen.
Right.
So I'm really proud that we're able to prioritize and work together.
Get people into the care they're asking for, saying yes to
Yes.
right away.
And if they say no, the message I want my staff to say is, okay, no's okay right now, but can we talk about it again? Can we have this conversation? Can I have that permission to do that? And it's usually always met with yes. Sometimes it's just there's a lot going on, and we need to give someone the grace to just be where they're at.
So to hear the no as a not yet, and always give the opportunity for a yes to come later if somebody needs that. One of the other things that I've always said about our SUD program, our substance use disorder program, makes it different, is because it's housed within the mental health center, is we have an understanding that, substance use disorder isn't this thing that occurs all on its own, right? That often there's anxiety or depression that comes along with it. And sometimes, again, back in those days of what we used to do when we were very siloed, is people with mental illnesses or mental health problems often got kicked out of substance use disorder programs. And we don't do that. And, maybe we bring in a mental health provider who works alongside the substance use disorder provider, or we allow people to move in and out of whatever treatment it fits best for them. I was trying to think if there's a story that's in there of anybody I could think of, but I can't think of any, but maybe you have a...
I can actually think
That's
of,
good.
I have a story. I've worked in the community for a lot of years in this area, and I would refer people to Greater Nashua. And I worked in another facility that often would receive the most difficult and challenging clients because other people would turn them away because they were behavioral. But they needed treatment.
They do.
And this was before integrated care. So I remember reaching out to Greater Nashua, and lo and behold, you were already familiar with this client. The person kind of went in and out of care, and you said to the person who answered the phone was like, of course, send them down. Well, here's your appointment. I think this was before open access. And I remember speaking to this client and saying, I have an appointment for you. Greater Nashua will take you. And they're like, oh, I didn't do well there. I'm like, that doesn't matter. This is a new day.
Yep.
You're telling me you're ready now. We're going to give it a try. And the person went and did engage. It wasn't an easy journey, but he had limited services in the SUD world, and which is how he ended up working with my particular agency. And he had limited services in the behavioral health world, but Greater Nashua said yes. And the last that I heard, this gentleman's doing relatively well. And it was a success story. It was about not giving up. It was about meeting someone where they're at. And, people change. And we need to allow them an opportunity to change.
Yeah. Just because you didn't like it or it didn't work last year doesn't mean it won't work this year. Or,
I think that's incredible. And I think that's a reflection of not only of the, what human behavior allows for change, but also about the type of staff, type of people that come to work at Greater Nashua Mental Health. I think they believe in the bigger picture. That we're empowering people to live better lives, to reach their potential, to meet their goals. And if today's not a goal day, tomorrow may be.
Right. Leaving that open. It always reminds me of the parenting analogy of if the 3-year-old doesn't like peas, you don't say to them, you hate peas. You hate peas, because there'll be a 9-year-old that hates peas. But if you say, maybe one day you'll like peas, when they're 9, they might try it again, right? And maybe they'll like peas at the age of 9 or 39 or whatever it might be.
That's right.
And so I think giving people the grace to change their minds and always leaving that open, that, because I think there's a lot of stigma. Like that gentleman you're saying, well, I didn't do well there. Like, and that might have been fear.
Could be.
Fear, they won't accept me, or fear they'll judge me because I failed before or something. And it's like, yeah, well, it didn't work before, but it doesn't mean it can't work today. Yeah.
I definitely agree. I had a similar conversation in the Greater Nashville lobby about a year ago, a little bit more than a year ago. I ran into a client who, a few months before wasn't showing up maybe in their best self, the way they were just having a tough time. And they saw me and they stopped and said, integrated care lady, actually, is what they said. And, we chatted and they said, and they made mention, I'm sorry, I didn't speak to you very kindly the last time we spoke. But I wanted you to know today, that I'm sorry and I'm in a different place. And I'm like, thank you. We all of us don't have good days.
Right. Not every day.
And then we start over.
Yeah.
That's just the way it is. Today is a new day.
And it's funny, you mentioned empowering people. Like, certainly that's our mission. And I think what we're describing is an empowering environment.
Yes.
Right? So an environment that allows people to have good days and bad days, that says, all right, even if you've failed at this before, we're willing to try again, or let's come together and figure out where we can start on this journey. And maybe if it's not quitting as the first goal, maybe it's just learning more as the first goal. Yeah. And that's an empowering environment because it lets people be people. And, it lets them show up authentically and not needing to worry about judgment, because a judging environment is certainly not empowering.
I agree. I like to think Greater Nashua, since the time I've been involved with it, doesn't set limits on their staff and on the consumers. Of course, there's always boundaries, and sometimes we're going to hear no, but we can problem solve.
Yeah.
We can bring new ideas to the table. We can talk about it. I like to think that everyone who is at Greater Nashua as a staff member, we're problem solvers. When someone asks me what I do for work, sometimes I just say I like to try to solve problems. To have a better result. And I think every day that I do that. When I hear no, or someone tells me something I don't particularly 100% agree with, I think about it. I'm like, can we talk about this some more? Is there room for us to inch a little bit further to help someone where they're at? Does it have to be a flat out no? Can it be more of a no, yes, no? Is there something that we can do?
Right.
And most of the time that's met with, okay, let's talk some more.
Right. Right. Like, to help me understand the no. Because if I understand where it's coming from, then I might be able to find at least ways to begin to help somebody make a change. And, certainly we have to follow rules, regulations, boundaries, like you say. But there is a lot of room for creativity. And people are creative when we, empower ourselves or have environments that allow for empowering to happen.
I so agree. I like it when I don't have to say no, even in parenting. I like it when I don't have to say no. I can't always say yes, but I can say, we can talk about it, or give me some ideas. Give me things to consider. I think as long as I always have things to consider and I can stay innovative, I can be the advocate for change that I want to be.
Yeah. Is there anything we haven't talked about that you have a lot of passion for that we do or that you get to do?
Yes. One of the things I love most about my job, which had to be switched up with the pandemic, is being in the community and talking about what we do and why we do it and why I want to be involved. I think that's part of my job, is to talk about what is integrated care and to provide that education, and asking how our collaborators in the community, how we can join together. How can we work together to get closer to the goals of being, having success and healthiness in the community. That's a big part of my job that I enjoy doing. Any opportunity to show up at a table, I will take. I think it's important.
So like, you mean like health fairs?
Yes,
or like...
health fairs, openings at new facilities, being asked to be a part of, of a committee or a board. I say yes to, because I think
Public Health Week
recently.
recently.
Recently we hosted Public Health Week. So those are things that I think it's important for us to be involved in. What we're doing is a public health service. Greater Nashua at large, but also in integrated care at small. Being able to provide that health education, that's important to me, and I hope, as we're stepping away a bit from the pandemic, that there'll be more face-to-face opportunities to talk. Just last week, I was able to be part of a Zoom presentation at St. Joseph's Hospital. They were talking. It was in particular for their pediatric programming, but I was able to talk about the services that we provide, that the 16 and above services at Pro Health and Integrated Care, but also provide some basic information about our child and adolescent programming. Education is power. People need to know what we do, and I think sometimes because we've been around for such a long time, they hear Greater Nashua mental health and they assume it's just mental health services, but many other things fall into that, like our fully functioning, SED programming.
Right. Or you made me think about the substance use disorder stuff we have going on for teenagers right now too.
Yes.
Like a lot of people just assume, there's no services for kids that have substance use disorders, but that's not true.
That's actually came up at this meeting I was on last week. They're like, there's not many services in the area, and I'm like, well, that's not true. We have it, and be able to provide that opportunity, and it's just simply, lack of information, and people just make connections in their brain about what things mean. So I feel it's my responsibility to be in the community, to educate on what I can educate on, and provide my support and do the best I can in the areas that are not my areas of expertise, but I can connect them. I'm really good at making connections.
Maybe you'll be the connection lady too.
I might. Yeah, I take those as titles of honor, and I appreciate it. It means that the word's getting out at what we're doing.
I mean, it's funny, right? I think it's yet another connection to empowering, right? I truly believe people empower themselves. Like I can't give you power, but I can create an opportunity for you to take on that power of your own that you already have. And information is one of those things. Like I'm not empowered to make a decision on my life if I don't have the information, or if I'm operating from my own lies, if you will, or history, or whatever my mind is telling myself in a moment. And so kind of our role in making sure people have that information, about health and its impact on mental health, and the impact of mental health on health, and how it's a spiral of things that impact each other.
When I go out and talk about integrated care, sometimes I'll be met with opposition. They'll say, well, I've been working in this field for 20 years and it's been just fine. And I said, well, I disagree, because, you can't, separate your head from your body, and that's what we've expected care to look like for many. Your head goes this way, your body goes that way, and that's just not really feasible. And, I said, do you remember what it was like, trying to provide case management to someone and never getting people on the phone to get information? Because I do, and I was frustrating, and I would have to say to my client when they would come in to see me, or I would go to see them and say, I haven't been able to get your doctor's office on the phone, or I haven't been able to reach your therapist yet. I don't have that problem at Greater Nashua Mental Health. I'm at a table with them, every Monday afternoon and every Wednesday at lunchtime. So I can say to my client, we just talked. We're going to be in touch with you, or this is what happened. And
or I was able to talk to your primary care doctor about that medication and side effects you're telling me about. And she was able to tell me, no, it wasn't from that meds. It might be something else. We can go off and look here. Yeah, how awesome is it to just be able to have that conversation and not say, I don't know.
Yeah. And it's also been wonderful that there have been times where we've been sitting around our huddle meeting and the client might still be in the waiting room. And I've been able to say, can they come in for a second?
Oh, that's awesome.
You know,
So then they're part of the huddle.
and they can come in. And that's happened, doesn't get to happen every week, but there's been times and it's just like, you know what, let's see if they want to come and talk for a minute. And we've been able to invite them in and, you know, provide some stress relief to, you know, to answer some questions, to let them know we're here. We're going to help. We have a plan. And sometimes that's what people need to hear, that there's a plan.
Yeah.
And we're going to help you. And I think that's a message at Greater Nashua Mental Health that our clients hear frequently. We're here to help.
Right. We're here. We're open. We're here.
And we are open, and we've been open. And I think that provides a real sense of security and safety that we haven't gone away.
Right. And we're not perfect.
No.
And we know we want to keep getting better and better and learning more and more and empowering ourselves to be better clinicians and better providers, because things weren't working before, right? People with mental illness were dying 25 years earlier than, you know, their peers. And so we knew we needed to do something different. You felt it when you weren't involved in it. And so how awesome to be able to offer that to people, to be their best self by addressing whatever they need to address whenever they need to address it.
And I think we've evolved a lot in just the 2 years that I've been here on the project. You know, we've been able to look at things and say, okay, how can we improve this? Or where do we need to step back? And I like that. It's nothing's in concrete.
Yeah. One of my favorite parts of the project was the requirement that we had peer advisors or client advisors. So we had to have a client go through the process to help us figure out where it could be better from their perspective rather than from, you know, maybe our expert perspective, if you will. I loved that about this project.
I like that because I was able to spend more time with clients doing what I thought I needed to step away from, but I truly didn't. I just needed to make it look different. So that's been exciting for me. I love being able to say, "What do you think about this?" You know, and they're like, "What? I don't know. You know better." No, I don't know better. You tell me what you think. I like being able to say that to someone.
Yeah, really empowering them to be part of the conversation. And it can be off-putting sometimes if you're a person with that experience that's not used to people hearing and seeing you and asking your opinion. You're like, I don't know, right? But I think the right environment can allow people to step into that. Like, you do know. It just maybe has been a really silent voice, and I'm here to help you make it a little louder voice so that you can speak up for how you want to talk about your mental illness. Some people don't want to have a label. They don't want to have they don't want to be referred to by their diagnosis. And other people say, no, that label has been helpful to me and is important to me. And, you know, other people want to be called patient or client. And I think the more we can honor people's voices, the more we allow them to be the best them they can be.
I agree. I don't even realize sometimes when I'm talking that I change. I go from client to consumer to patient because I interact with so many people and try to be aware of what they prefer. That now when I talk, I kind of go down the list because everyone is an individual, and I try to respect that. You know, what means most to them.
Yeah, right. What resonates most? What allows them to feel seen, heard, and have that voice? Well, unbelievably, we're like already toward the end of our time together. Isn't that fast? It goes quick, doesn't it?
It does.
But I do like to end by asking people like their own personal something that they do in their own life that's empowering for you. Because I think our listeners can learn just from hearing different ways people empower themselves,
to sort of take away, and what can they maybe do different in their own life?
Two things that are really super important to me. One is exercise. I run at least 5 days a week. I need that for me. And because, I work until, 5, 6 o'clock at night, my kids are a little bit older. And when I get home from work, the first thing I do is change my clothes. And I'm going, my youngest, who's almost 15, will be like, what about dinner? I'm like, you're not going to starve if it's an hour late. You'll be okay. So I have to take that time for me. And she's amazingly alive at 7 p.m. She's okay. So I run, and I talk to clients about that, about the importance of, what physical fitness can do, in all sorts of ways in our life. The second thing that I do that is important to me, and I struggle fitting it in, but I make sure it happens, is I also teach. I think it's important to give back to the community and to young people entering this field or that have a desire to enter this field. So if I can help them along in their journey and provide them not only education, but like real life experience, because I always enjoyed when a professor was able to step away from the textbook and provide like practical, remember when I was working in the field or when I was doing that, I was able to connect with that, and I think it helped me on my journey. So I'm able to do that. I fit it in. I make sure I at least teach one course every semester. So those are two things that empower me, help me empower others in the process.
So giving back and making time for exercise, even if there are other humans saying, no, don't take that time.
Yes.
You take that time.
Yes.
What a great example for others to follow, that it is okay to say, no, I need this right now.
Yeah, we've got to practice what we preach.
We do got to practice what we preach. Well, I thank you so very much for joining me on Empower Hour. It has been a delight to just sit here and chat with you and learn from your perspective about what's, the importance of integrated care and the programs that we have going on at Greater Nashville Mental Health. So thank you very much.
Thank you. It was a very fast hour.
I know, it goes real fast. And thank you so much, those of you that have watched the show today. We thank you for your support of Empower Hour with Greater Nashville Mental Health, and we wish you a very empowered day.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.